Inez Jasper is an upcoming First Nations musician. Her concerts and shows fill venues across Canada. She lives in Stalo territory in British Columbia near Chilliwack. Inez is also a nurse in her home community, working on the front lines of Canada's healthcare system.
I remember in school there was always people who had measles really bad and they got really sick. Some kids had whooping cough. Now that I work in health, there's some of my clients who are elderly. They had polio when they were younger, and there's even a young man in our community. I remember he had polio when he was a little boy. So, they're out there still. So if you're not protected against them, you can, if they're flying around, you could catch it.
Inez isn't just a pop star winning Aboriginal People's Choice Music Awards. As a nurse, she has a full-time job and a side career. This busy mom has a happy and growing baby boy to take care of. Part of that responsibility is ensuring that she keeps up to date with vaccinations.
The kind of immunization program we have in our community here at Stalo Nation Health, it's directed by the BC CDC, so they give us a immunization schedule that we follow, and we aim to have all the children and babies in our community immunized according to that schedule. So the immunization program here at Stalo Nation has been received very well. It's been in effect for many, many years, so a lot of families are familiar with it, so a lot of parents do immunize their children. Most of the reaction is that because it's coming from a nurse, a lot of people are trustworthy of the nurse and the information that we're providing, so parents usually take the information and follow what we recommend. I think vaccinations are really important in our community, especially the Aboriginal community. Before I was a nurse, I wasn't too sure because I don't think I had enough information to make a decision, but after now being in the workplace and being certified through the BC Centre of Disease Control to give vaccinations, I had that information. And in our history as Aboriginal people, we've been so affected by different diseases like smallpox, like influenza, and the pandemics that came through, and it killed so many of our people that we lost so many of our people that we need to protect ourselves through vaccine programs. And like things like flu, and the people that are most susceptible are children, babies, and elders, and we've lost so many of our elders. They carry our knowledge, they carry our languages and traditions, and we really need to have them as long as we can and keep them healthy. So protecting them against those diseases means vaccinating them. If someone was suspicious of vaccinations, I encourage them to find as much information as possible, and they usually are really proactive in terms of looking up information, but what I would suggest is to make sure that they have information from a credible source, which is controversial again because we refer them to the BC Centre of Disease Control, and of course that's the organization that they may be suspicious of because it's driven by the provincial and federal programs. But there are many non-credible sort of websites and whatnot. If you search vaccination or immunization shots and things like that, there are many websites that come up that are anti-immunization. So just really think, looking at both sides, take time to look at both sides of the argument before making a decision. Talk to different healthcare professionals and different families in your communities that have experience with immunizing their children, because really there aren't many people that have had negative experiences with vaccines as of late. He had his first set of shots when he was 2 months old, so he had 4, and it sounds like a lot, but I think the pokes are the worst part of it, and then they get what's called the antigens, and then their body learns how to fight the disease if they ever encounter it. So they have what's called an immune memory, so to speak. Well, like some of the common reactions that we see at the health center with vaccines are like they get a little bit sore on the spot, or they might fever because the body's reaction when it thinks it's getting sick is to have a fever. And so for my son, when we brought him home after his immunizations, he fevered, and a lot of kids I hear get fevers, and we encourage them to treat them with Tylenol. So he experienced that, but out of all the kids that I've heard, he fevered through the night, so we had to keep giving him Tylenol. But I mean, that was it. Just like when he was sick, we gave him Tylenol, and he was fine after that. Looking back, when at first my husband and I, because we're first-time parents, we were really stressed out, thinking, oh gosh, our son's really sick from these vaccines, and did we make the right decision? Because he was upset, we were upset, we're up through the night with him. And then, looking back, I had to think like a nurse as well, and think, this is much better than him having some of these horrible diseases that he was just vaccinated against, because he could have easily ended up in the hospital, had severe complications, or even died from some of these diseases. So a fever is nothing compared to that.
This is Inez's mother-in-law, Brenda Jasper. She is a big part of her family's life. She shares stories and history from previous generations. As a proponent of vaccinations, Brenda talks about how important they are for the health of the community.
I think it's important for everyone in our community and family to be immunized, to stay healthy, and to continue to be healthy and pass it on to our children and grandchildren, the importance of being immunized. There's so much more in today's world than there was in the past. It just makes more sense nowadays to follow through with the immunizations. Without the knowledge of the diseases and what you can do to prevent them, it makes a lot of sense for people to go in and do what they can to prevent getting any diseases today. There's so much information out there. There's so many people that are willing to help and explain and follow through with any immunizations you need today, or medical problems. And we have more and more nurses like Inez that are just incredible, that come out into our communities and make us feel at ease. And they say, well, they're human too, just like us, and have just as many questions and concerns, and they have the knowledge to talk to us and explain it to us, take the time for us.
There's been a lot of changes in the perception and beliefs about communicable disease. I think before there was a lot of fear about communicable disease because, well, not too long ago, our people were dying hundreds of people were dying from smallpox, and hundreds of people were dying from the flu pandemics. But it wasn't just in the Aboriginal community. Everybody was experiencing the deaths. But because our community had never seen those diseases before, it hit our communities really hard. And so, people weren't sure about vaccines. Was this really going to help us or hurt our people? But now there's more education offered in the community, and we're realizing that we need to protect ourselves, especially our elders, because they carry a lot of our language and culture, and we want to make sure that we can keep them healthy so that we can learn as much as we can from them to keep our traditions alive. Well, for me, in my family, I think it's important to protect my son and our family from different kinds of diseases. So, of course, protecting ourselves, but by protecting ourselves, we're protecting community members. So, like, my son, he's a vulnerable population because he's a baby, and then I have people in my family who are elderly. So my grandparents and great-grandparents, we want to protect them from becoming sick because they have low immune systems. And then also my dad is diabetic and he needs to be protected, and my father-in-law has a chronic illness, so we try to protect ourselves to protect him. So there's so many reasons in our family. And of course in the Aboriginal community, there's a lot of people that have diabetes and other chronic illnesses, so we just need to protect each other by protecting ourselves.
I'm Adam Beach, and this video was brought to you by the National Aboriginal Health Organization.